I think this was a picture, probably one of the last photos that was ever taken of Frankie and me together.
Janice Flood Nichols is one of the estimated 1 million polio survivors in the United States. In 1953, her twin brother lost his brief battle with the disease that many younger Americans are unfamiliar with.
It was just an overnight thing. I mean, a few days before, he was a healthy, happy, rambunctious little boy, and 61 hours after he was admitted to the hospital, he was dead.
Jan, Frankie, and their community were victims of one of the many polio epidemics that targeted young children and horrified the nation.
Our parents just wanted a peaceful and a prosperous life for their children. So DeWitt was an innocent place to live. And then suddenly all these young children were struck by polio. So I think in a way the community kind of lost its innocence.
While Jan and Frankie's story is tragic, it is also a story of personal and medical triumph.
So I think we did something very positive. Everybody just fought back.
The story of how Jan battled back against the disease that claimed her brother's life is part of the larger story of how immunization has changed the world.
I think you could argue that since 1900, from 1900 to 2000, our lifespan has increased about 30 years. And almost all of that increase has been due to vaccines that save our lives.
Vaccines probably rank at the very top of public health success stories in the history of medicine. It's extraordinary to imagine the change in morbidity and mortality. That is, infectious diseases used to account for probably the most number of deaths among children. 1 out of 3, 1 out of 4 children used to die before the age of 5. Nowadays, it's probably more like 1 in 1,000. And that change is partly due to vaccines, not entirely. But if you look at the value of medical science for improving health overall, vaccines are number 1 on the list. Probably the best example of the change in mortality is smallpox. It's hard to remember because almost all of us don't have a lifetime experience with smallpox, but it used to be among the most infectious diseases. When it came to a town or city or village, just about everyone would be infected. 1 out of 3 people would die from that infection, and almost all the rest would be left with some sort of mark. That's the idea of the pox on your face. The interesting thing about smallpox is that people recognized pretty early on that you only got it once. And so this gave the idea that, well, maybe if you got a more minor version of it, then you wouldn't get the more serious version of it. And the first ideas of inoculation sort of came hundreds of years ago, probably in the Arab world, out of this idea of maybe that's a way to prevent death and disability. Over the years, there were changes, and one of the most important was Edward Jenner, who recognized that a different version of smallpox, cowpox, which is a virus that's related to smallpox, if you got infected with cowpox, what would happen is you would get very mild disease, nothing bad at all, because it was actually much worse for cows, but they would protect you against smallpox. And here the idea of immunization, that if we gave something to your body that would help you mount a defense, then the next time you saw the real virus, you'd be able to fight it off. So it's a way of taking advantage of your body's natural defenses.
Doctors soon discovered that Jenner's idea worked. Deaths from smallpox plummeted in England, and vaccination spread throughout Europe and North America. Soon scientists and doctors began creating new vaccines to fight other deadly diseases like rabies and cholera. But despite the advances in health and science, disease continued to take a terrible toll.
It was a terrible, terrible time. We were scared, very scared, rightly scared of infectious diseases which killed us. You would have measles, would cause 100,000 children to be hospitalized every year. Polio, routinely paralyzed as many as 15,000 children a year and could kill 1,500.
Polio is a disease caused by a virus that attacks the body's nervous system. The damage caused by polio can lead to paralysis and sometimes death.
What you have to remember is that up through the 1930s and 40s, polio was an extraordinarily scary disease. You never knew when it was coming to town. Every summer, people would worry, is this going to be the year that polio comes to our village, our town, our city? And if it did, you didn't know what was going to happen because every once in a while, a regular cold, a little bit of a flu, would turn into paralysis, would turn into the ability not to breathe, could even lead to death.
But it was a few days before Halloween, and Frankie developed a little cold. It wasn't even a bad cold, it was just a head cold.
Jan Nichols and her twin brother Frankie were happy, healthy 6-year-olds in DeWitt, a suburb of Syracuse, New York, when their lives took a tragic turn in the fall of 1953.
But they kept him home because we wanted to go Halloweening with our friends that weekend. But the day before Halloween, Frankie suddenly developed a terrible time breathing. So he was rushed to City Hospital, which was a hospital for communicable diseases in Syracuse at the time. He was immediately placed in an iron lung because he couldn't breathe, and he was given a spinal tap to determine whether he had polio or meningitis. By the next morning, they knew that Frankie had polio.
Within 62 hours of being admitted to the hospital, Frankie was gone.
He died with my dad, cradling his only son the best he could, when Frankie's little head and neck were the only things that were outside of that iron lung.
But polio was not through extracting a terrible toll on Jan and her family. On the very day Frankie was laid to rest, a new crisis.
I went to the wake, I went to the funeral mass, and I went to the burial. After the burial, we went up to my maternal grandparents' home where all the family and close friends had gathered. And suddenly I developed just a terrible, terrible headache. I think anyone who has ever contracted polio will talk to you about the unbelievable headache that accompanies it. My parents called our pediatrician and they drove me home. The doctor came to the house and he asked me to take my chin and put it down to my neck. I couldn't move my chin from here to here, which is an early sign of polio. So I was rushed to the hospital. The doctors told my parents that they didn't know whether I was going to live or die.
While Jan hovered between life and death, polio ravaged her close-knit community.
It was an epidemic that struck very, very quickly. Within a couple of days, 8 children out of our first grade classroom of 24 kids had been admitted to the hospital. And within 20 days, 13 people in DeWitt had been admitted to the hospital. So it was just this horrible thing that happened to our family and to our community really overnight. Frankie died and 2 of our friends died.
Eventually, Jan began to recover and regain the muscle function polio had taken away.
I was a very sad little girl at that point. Learning to walk again or try to walk again was really, really hard, but my biggest trials were just trying to come to terms with not having Frankie anymore.
As she recovered, Jan and her family became involved in the historic battle against polio.
All of our mothers became very involved with the March of Dimes.
When future President Franklin Roosevelt contracted paralytic polio in 1921, it inspired him to start the National Foundation for Infantile Paralysis, later renamed the March of Dimes.
The March of Dimes started as children collecting dimes door to door to build up a fund to be able to take care of people with polio. And in particular, the president and others said, if we invest enough in medical science, we can figure out a way around this.
So they started raising money throughout the country to fund a vaccine trial, and they paid for the research of Jonas Salk at the University of Pittsburgh to come up with a vaccine that was safe and effective.
Dr. Jonas Salk was a researcher who had been working since the late 40s to develop a polio vaccine. In 1952, he made a breakthrough, and in 1954, Salk and his team were ready to conduct the Salk vaccine trials, the largest statistical field study ever conducted in the United States, a study Jan and other children in her community were part of.
They told the parents and the children who participated that we were doing something not only for our own generation, but for all future generations, because if they could come up with a vaccine, they could stop the terrible scourge of this disease. So my parents readily wanted me in the study. I needed the vaccine just as much as other children did, and I wasn't scared to get it. A shot is nothing compared to trying to learn how to walk again, or to be able to be in an iron lung because you can't breathe or swallow on your own. Shot's nothing.
Nearly 2 million children participated in the Salk vaccine trials. The success of the trials led to jubilation across the world and a campaign to eradicate polio here in the U.S.
By the late 1950s, polio had virtually disappeared from the United States. And it was this really powerful example in the American psyche of how government funding, private philanthropy, and medical science together could eliminate any problem. And in this case, it was polio.
We have the luxury in this country of really not having new cases arise in our country of polio. But in many parts of the world, that's still reality.
I got the smallpox vaccine as a child. Young parents today and their children don't need that vaccine because smallpox has been eradicated. I want polio to be number 2. And with the money that we save by eradicating that disease, we can go after all the other vaccine-preventable diseases.
The polio vaccine came too late for Jan Nichols' twin brother Frankie, but she says it's not too late to warn parents who may be hesitant to immunize their children.
We know what these diseases are like, and they're awful. And yet, if you've never seen them, parents can think, well, why should I be afraid of this? Especially when they hear all the misinformation on TV, on the internet. They don't understand these diseases. So what amazes me more is that parents aren't afraid, some of them, to vaccinate their children. I don't understand it. So my heart aches for these parents. I just want them to listen to the people who understand these diseases and protection and prevention the best. They're pediatricians, they're family practice doctors, the infectious disease community, the CDC, World Health. All they want is healthy children. And vaccines have done more good to prevent more illness and death than probably anything else in modern medicine.
Vaccine registries like Florida Shots represent the next chapter in the history of immunization. Computerized immunization information systems like Florida Shots allow for safe record keeping and the type of instant tracking that has never been available before now. Florida Shots also simplifies things for providers and parents.
To tell you, nowadays it's so complicated, the schedule's so complicated, it's hard for a doctor to know exactly what's been done for a child and what needs to be done. It takes a fair amount of time and energy. And I think the biggest advantage we're going to see in the next 5 to 10 years will be using electronic health information to make sure kids get the vaccines they need.
Another program shaping the future of immunization and healthcare is the Florida Vaccines for Children program. It's part of a federal program created in the aftermath of a major resurgence of measles from 1989 to 1991. The CDC learned that more than half of the 55,000 measles cases reported during that time involved children who had not been vaccinated, many of whom were financially challenged. In response, Congress created the Vaccines for Children program in 1993. It provides vaccines at no cost to children who might not otherwise be able to afford them. Advances in vaccine research and development, combined with immunization programs like Florida Shots and the Florida Vaccines for Children program, are helping create a healthier tomorrow for families throughout Florida.